Namaskar. So, hello everyone, and today we are going to discuss something very important regarding family medicine. As you all know, that NEET PG 2024 results have come out, and we have started receiving messages that which branch to take, what are the options we have, and what is the best way to go forward for family medicine. Everyone, I am Dr. Pratyush Kumar. I am a family physician working in Bihar, and I have done my family medicine from Sir Gangaram Hospital, and currently, I am also part of Academy of Family Physicians of India, which is a family medicine organization representing family doctors across India. And I'm also part of WONCA, chair a rural health group in South Asia, which is called as WONCA Rural South Asia, and secretary of Rural WONCA, which is WONCA Working Party on Rural Practice. And WONCA is World Organization of Family Doctors. It represents family doctors all over the world. So the most frequent question is, should I take family medicine or not? Simple answer is that family medicine is a broad specialty, and here the teaching involves general medicine, general surgery, obstetrics and gynecology, pediatrics, and also the short specialties like ENT, ophthal, dermatologies. Even there is posting in emergency and ICU settings. So here it's a full range, full scope of practice. You'll be trained. You'll be trained as a family physician, so that any patient with any problem, you will be the point of first contact. And the main purpose of family medicine is to resolve more and refer less. And for that, all the skills required will be trained during your 3 years curriculum if you're opting for DNB family medicine. And now we also have the option of diploma in family medicine is also there. So first start with the DNB in family medicine. These all guidelines are there in the DNB website. I'll just go through the brief way that it's basically a generalist curriculum where you are being trained in all scope, full dimensions of family medicine, from pediatrics to geriatrics, from head to toe. Like, it's not centric, it doesn't have any narrow approach, it's a very broad approach is there. And the family medicine training goes through 3 years, and this curriculum is also there. There could be differences from college to college regarding the postings, but overall they will give postings, major postings in medicine. It takes around 3 to 6 months, or even more, even to 6 to 9 months will be there in the medicine specialties. You may also be posted in some of the subspecialties like cardiology, nephrology, neurology. So you can also have posting including medicine, general medicine postings in your training programs. So according to, if you look at the website here, you'll see that the posting in pediatrics is 6 months, obstetrics is 6 months, internal medicine including mental health is 6 months, and emergency medicine is 3 months, general surgery is 3 months, and miscellaneous posting is of 3 months duration. And these are some of the procedures you'll be learning in anesthesia, like endotracheal intubation, intravenous access medicine, CPR, the pleural aspiration, peritoneal aspiration, ECGs, intracardiac injections. Now obstetrics, you'll learn about conduction of normal delivery, suturing, episiotomy, IUCD insertion. Ophthalmology, you'll learn about fundoscopy, very important for diabetes patients, and removal of foreign bodies. Orthopedics regarding splinting of fractures, reduction of simple fractures and dislocation, application of casts. In ENT postings, removal of foreign bodies, syringing, nasal packing, use of otoscope. In pediatrics, you'll learn about resuscitation of newborn and intraosseous infusions, very important in your emergency practice. And pathology, you'll be also be trained for various skills regarding hemoglobin estimation and differential counting. These you'll have also posting there. Then comes very important part of your DNB curriculum is thesis. Here you have to submit a full thesis in your first year. You also need to submit a logbook where you have to keep track of all the patients you have seen and their family profiles and all the procedures which you have learned. So in that, there's leave options also there, like maternity leave is there for 90 days is there, and DNB course, there's academic leave of 14 days in the 3 years course, and if you have got a 2 years, then 10 days leave is there. And obviously will final there will be a theory examination and practical examination. The formats keeps on changing, but usually they have got 3 to 4 papers in theory, and they have got a practical examination where NB will give you a center, which usually in a different state, and where you have to go and pass on all the vivas and all the cases. Obviously, there will be 2 major cases and 2 minor cases, but the things will change. It changes from year to year. So it depends, but mostly you have to pass first the theory exam, and then there will be practical. In practical, there will be cases from medicine, surgery, gynae. These important cases will be there. Pediatric short cases are there which you need to clear. So this is about DNB in family medicine. So if you're concerned that why you should take family medicine, suppose you want to start your own practice, you want to see medicine cases also, pediatric cases also, surgery, gynae cases also, then family medicine is the best specialty. If you want to start your own practice, if you want to start your own setup with emergency patients, ICU or inpatient, family medicine is the ideal branch. You should also understand that it's the end specialty. Like after doing family medicine, there's no scope of further any subspecialty like neurology, cardiology. You can't do that, because the whole aim is to train as a broad where you can see patients from all age group, from all systems. So again, going back to a narrower specialties defeat the purpose of doing the family medicine. So that's not there. But yes, there is further training, further special interest you can have. You can have special interest in diabetes. You can have special interest in different items like sports medicine, physiotherapy, or the acupuncture. You can have in sports medicine, ultrasound, or emergency medicine, ICU training. So there are different kinds of other specialties of interest where you can pursue some fellowship courses or diploma courses to gain additional knowledge depending upon your interest and the patients which you're seeing in your daily practice. Like if you're seeing more of diabetic patients, then it's worthwhile to do a fellowship in diabetes. If you're making a setup in ICU, you're planning to make up a ICU setup, then you can do a course in emergency training, additional fellowship courses that will be useful to you. Apart from that, there are many fellowship courses. I have made another video on fellowship courses like further. And then one of the most important question people asking, what is the scope of family medicine? So after family medicine, what you can do? So after family medicine, you can just do SRSIP, which is senior residency in family medicine. It's available in most of the medical colleges where there is a department of family medicine where you can pursue as a senior resident in family medicine. In other departments like Department of Geriatrics also you can do senior residency, because family medicine graduates are allowed to do senior residency in Department of Geriatrics also. I have done senior residency in geriatrics from Patna Medical College. This is the second option. And then you have to, if you are going for corporates, then you can join as associate consultants or consultants. You can later become consultants. Many family medicine graduates are working as consultants in reputed corporate hospitals in all the major metro cities, or wherever you have got opportunity you can work. There are lots of options there. So that's there. And then obviously private practice is the most it's the best option if after you have done family medicine, because there is full scope of practice is available in private practice. And if you're doing a rural practice, it's the best branch. If you're planning to make a rural setup and do all kind of practice, interventions, procedures, you'll get lots of options. These all options are there with you if you're pursuing DA. If you want to do a DNB family medicine, is a very good specialty, especially if you want to do a full scope of practice from pediatrics, medicine, gynae, surgery. You do a full scope of practice. Family medicine is the best specialty. If you want to start your own setup, having in your own ICU, inpatient, then also family medicine is going to be very helpful, because during the 3 years training program, you'll be trained with the skills required to start your own setups. So it's one of the best branches. And if you've got any questions, any queries regarding counseling processes, which colleges you should opt for, whether it's good for you or not, you can very well ask me in the comments, or you can just message me or call me. I'll be happy to answer you with any query.